Yes, I got a thumbs up. All right. Well, welcome. My name is Tatiana Havryliuk. I'm an emergency physician. I've been using POCUS for over 15 years. And I'm really happy to be here to tell you a little bit more about how you can build confidence in your point of care ultrasound skills and achieve the standards that currently exist for credentialing and proficiency. So really, this session is designed for two groups, the clinicians who maybe have taken some POCUS courses in the past and want to build that confidence, and also for the administrators who are looking to bring point of care ultrasound safely into the clinical practice. All right, and a little bit more about myself. This is actually me doing point of care ultrasound at 17,000 feet in at Everest Base Camp on a glacier. And the point of this slide is really if we can do POCUS there, you can definitely have it in your clinic. These are my two awesome cats, Hunter and Sage. And I've also been recently really into pickleball, so I'm really excited to hopefully meet some of you on the court. I know Shelly, I'll be seeing you soon. And I think before we proceed, why don't we just do a quick poll of the audience here to kind of see who has joined us, what type of practice you are in, you're an administrator or a clinician. So yeah, thank you, Lana. So if you guys could just help us answer a few questions. We just got two. All right, so we've got some urgent care providers, an emergency medicine, primary care provider, and some administrators as well. And there's a second question in the poll. Okay, I wasn't seeing it. All right, so seems like at least one person is performing some ultrasound for clinical decision making, but not billing. And then most of you are not using POCUS and billing for it at the same time. Great, thank you for participating, and we'll proceed. Did you guys see the results? Lana saw the results. Okay, perfect. So we'll keep going. Um, I have noticed two big gaps when it comes to POCUS adoption, either in urgent care or primary care or non-academic centers. Really, the first gap is that provider competency. Uh, Clinicians often get some training and exposure to POCUS, but they are not really feeling confident to make clinical decisions based on their scans. And that's what we are focusing on today. The second gap is really that operational readiness gap of um, how do you build POCUS into your own practice, make it compliant, make sure you can bill for it. And that's a conversation for a different webinar. We'll tell you about it later. So let's focus on this competency piece today. So today's agenda, we already got to know you. I forgot the poll was later. What are the credentialing standards? And I'll tell you a little bit about Hello Sono solution to help you achieve those standards. And we have a little special offer at the end. And of course, Q&A. So get your questions ready. Um, all right, so at first, I would like to start with two questions. One is why credentialing standards exist, and the second one is why credential providers. So for the first one, the standards exist to ensure patient safety, provider competence, and consistency in care. So although they are not rigid rules, they are really framework to adapt based on available resources that you have at your institution. And why would you credential providers? I mean, there are a lot of different reasons. The first one, it proves that you have some baseline skills to make clinical decisions with point of care ultrasound. It gives you some medical legal protection, keeps you aligned with the standards from major medical organizations. And also importantly, it gives you documented proof of training in case you do get audited by your payers. who might want to know what training you had, why are you able to be performing POCUS and also billing for it. So when it comes to credentialing standards, it's pretty consistent across major medical organizations, whether it's American College of Emergency Physicians or AFP or AIUM, American Institute of Ultrasound of Medicine. So here I'm just sharing the framework that exists for credentialing standards. So there are four main steps for the framework. The first one consists of didactics. So usually those are online modules or courses where you learn the basics of how the ultrasound works, some of the physics behind it, how to obtain required views, and also importantly, how to interpret those images and incorporate them clinically into your clinical decision making. So what the difference with POCUS, you are not just acquiring images, you're also interpreting them and incorporating them clinically. And it is recommended to spend about 4 to 8 hours per application. So if you're learning 4 different ultrasound applications, say lung, cardiac, aorta, and musculoskeletal, you really should be getting around 16 hours of didactics at a minimum. So 4 per application at a minimum. The second step, so you've got your didactics here, and a lot of times it's a good idea to start with some didactics and then jump into this hands-on training portion. So typically a 1 or 2 day workshop is recommended. With live models, it's ideal, but depending on your resources, simulation can replace also some of that hands-on training. But remember that doing ultrasound is very tactile, right? It's a physical skill. So this is a critical step to have accomplished as part of your credentialing process. And the third one is really probably the most lengthy process, but very important. And that's that supervised scanning or the confidence builder. So the supervised scanning can be either in the form of a preceptorship, where you have an expert who's at the bedside who can give you feedback on your scans immediately. That's an ideal situation, and that's what a lot of times residencies and fellowships in large academic centers can have. Or another way to get this supervised scanning is to do retrospective exam review, right? So get feedback from experts remotely. And it is recommended, it's a researched number, but it's recommended to gain this proficiency, you need at least 25 scans, but 25 to 50 is recommended per application. And obviously, there is going to be some variability depending on a person. So some people might become quite proficient in an exam, with 20 scans, and some people might need 30 or 50 scans. So you need to be flexible a little bit with this number and have some assessments in place, which is another important step in this process, right? To make sure that clinicians are demonstrating proficiency in image acquisition and also interpretation. And usually this assessment piece is done as a combination of a written test, maybe question bank online, plus that exam review report. So how are they interpreting the images that they are submitting well? Are they getting a lot of true positives and true negatives and not too many false positives and false negatives? So this is the basic framework. In addition, you got to think of how are you going to maintain your credentials once you achieve your initial credentials in point of care ultrasound. This is with any skill in medicine, right? Procedural skill. You want to have some ongoing education. Typically, it's 2 to 4 hours of focused learning, either online, CME courses, refresher workshops. It could be journal clubs, image review. So various activities can qualify. Ideally, you would like to be also getting CME for those, but that could be one of the requirements for the maintenance. The second one is this continued clinical use. It is recommended to perform at least 10 scans per application per year. So if you have providers who are credentialed in 4 different POCUS applications, at a minimum, they need to be performing 40 applications to maintain their credentials throughout the year. And this number might vary. So if you're in a very rural place and you might not have a ton of patient volume, so maybe you're not using POCUS as frequently, this number might be lower in your case, and you would supplement it with additional education or maybe training on sim models instead. And of course, one of the other things to consider for maintenance of credentialing is this ongoing quality assurance. So ASAP recommends 5 to 10% of scans to be reviewed for quality even after the provider is credentialed. And that could be, it's typically done internally, but can be also done externally. And the idea is really to ensure that the quality is still there. So this slide is a little bit, gives you a bit of a guide on how to build your own credentialing protocol. So these are some of the key elements. First, you want to define the scope of practice for POCUS. So typically you start with some core POCUS applications in your institution, in your practice, in your clinic, and then you might want to define some advanced applications for advanced users. You want to set your training requirements, so specify the required number of didactic hours and also the initial hands-on training. And you also want to have a way to get people in scanning with you by reviewing how many scans, say they've got training somewhere else before, right? Whether it's in residency, whether it's in different workplace. So there's also a different pathway where you can look at their prior training and credentialing, and they can submit the paperwork for those to see whether they meet your credentialing standards. So this could be part of your protocol. You want to also have some standards for the number of supervised scans you will require as part of the credentialing process. And we talked about 25 for diagnostic scans. It's usually less for procedural. So ASAP recommends 5 to 10 scans for procedural ultrasound guidance. You want to have some form of assessment, whether it's a written or practical or an observed exam. In many places I have worked with develops POCUS programs, when a new provider is onboarding and they are seeking POCUS privileges, the POCUS expert would actually watch them scan. And that's a very easy way to make sure that they know they are meeting the exact standards that you have in your practice of image acquisition, for example. And then, of course, in your credentialing protocol, you want to have also a section on ongoing quality assurance and maintenance of credentials. This is a question I get asked a lot. What is the difference between credentialing versus certification? So credentialing is an internal process based on your current resources and goals. Although we often cite credentialing standards and guidelines from ASAP, AFP, AIUM, right? So you want to use them as a guideline, but then you are actually creating your own internal credentialing protocol for your own situation. Certification, on the other hand, is typically external. So there is quite a bit of variability in certifications on how vigorous they are, for example. And in fact, ASAP does not endorse, and other organizations do not endorse certifications. However, certifications, someone just handed me a note. That's why I was distracted. Sorry about that. Uh, but certification can be a necessary component of your credentialing pathway if you don't have enough internal resources to fulfill your credentialing requirements. So that's something to consider depending on the institution and the practice you're in. Another question that I get asked a lot is, how long does it take to get credentialed? How long does it take to develop competency, proficiency, confidence, whatever you want to call it, in point of care ultrasound? And really, the honest answer, it depends. It depends on the type and the number of scans you're learning at one time, the learner's prior ultrasound experience, learners' motivation, patient volume. So all of that kind of needs to be accounted for. So to give you a ballpark, if you're learning 4 POCUS applications, you've got to perform 100 scans, right? 25 per scan. And those are 100 educational scans. So it takes some time to collect those. Most clinicians complete the initial credentialing process somewhere between 3 to 12 months. 3 months would be for those who have large patient volumes, really motivated, and are learning easier applications like soft tissue, musculoskeletal. The basic musculoskeletal exam are quite quick to perform. DVTs are quick to perform. If you're learning cardiac ultrasound and lung ultrasound, that might take a little longer. So in summary, in terms of the credentialing standards, right? So remember that credentialing takes time. We just talked about 3 to 12 months for the credentialing to take place. So please do give it time. Make sure you are budgeting that time uh, into into your clinical hours or outside of your clinical hours. And also remember that exam review, that supervised scans and feedback are really important to build confidence and also become proficient in this exam in POCUS. So we have another poll for you really quickly, uh, and that's around how many of you currently have a structured way to get your POCUS scans reviewed. And I would think not many of you would. Okay, so far we are getting no's for the answer, and that's why you're probably here. You're learning about it, and you're either building it out or um, figuring out how to get some structured feedback and a structured way to achieve credentialing standards. All right, thank you guys for participating. So we'll end this poll. Oh. Now I know that credentialing can feel a little bit out of reach for some of you, and like my cat Sage here, reaching for treats. And for many of you, it may be because you don't have access to an POCUS expert, or you simply don't have the bandwidth to pull the whole program together. And really, I think that's where Hello Sono can help with some of this process or establishing a process. So I just wanted to tell you a little bit of what Hello Sono does and how we can support you in achieving that confidence in your scans. So we have really simplified the review process in a way. It's become very simple to get expert feedback on the scans without adding any additional software. So there's no software, there's not real subscriptions and no platforms that you need to be learning. It's a pretty straightforward process. Ooh, and this came out first for some reason. But the first thing you would do, you would obtain your scan. And if you're using a handheld device, uh,
Have a
basically
little,
you can,
sorry to interrupt. There's a little notification fail to share poll right on your presentation. Do you want to click that off? It's just in the middle.
oh,
Sorry
I
to
don't
interrupt.
have it. Does everyone else see that? The failed
Oh, I think it's just me. I'm
notification?
so sorry. Go ahead.
Oh, it's just you. Okay, okay. All right. I was like, I don't know. I don't see it. Thanks, Lana. All right, so you perform a scan. If you have a handheld device, you can typically share a de-identified images or scans via email. You literally attach it to your email. There's no patient data on it, and you put in your interpretation. Hey, this is a left knee ultrasound. I'm seeing it at suprapatellar effusion. You can put in your questions in there, what findings, what views you submitted, but very quick. It's almost like a mini procedure note that you're putting in the email. Our expert reviewers will review it within 3 to 5 business days, and you will get a structured feedback where your your actual scan gets graded on a scale of 1 to 5, which is the standard, and you need to have a minimum of 3 to meet the basic standard for image acquisition. We'll also tell you whether it's a true positive, a true negative, false positive, false negative, and give you a custom feedback on how you can improve your scan. In addition, some bonus points is that on a monthly basis, you'll on an email telling you how many scans you submitted in the last months, how many of them met the basic imaging requirements, and also it will give you your totals, right? So if you're looking to get 25 scans of each, this is how many you have so far, this is how many you have left, and also will tell you your average image quality. In addition, at the end of this whole process, once you complete all of your scans, you get a certificate really outlining exactly what was reviewed, how many scans were good. In addition, depending on kind of what program you are in, you are able to get CME for some of this. So I'll explain a little bit more. So there are two different packages that we are offering currently, and it's really the starter package for someone who is just wants to try it out, or maybe they're seeking proficiency. They just want to see how good their scans are. They're not really trying to meet any specific credentialing criteria currently. So this starter package and the level up package is a little bit more advanced to get the actual credentialing criteria. But our starter package, it starts at $250, and you basically get 10 expert reviews by fellowship trained physicians in ultrasound. You get a certificate outlining of what was reviewed, and that's pretty much it. Very simple. The level up package starts at $500 per application, and really the idea here is to get you to meet the credentialing standard for one application at a time. So you get 25 plus expert reviews with this one. You get those monthly reports that we talked about. You get CME credits. It's 3 credits per 25 scans. And you also get that detailed certificate at the end. So this could become part of your internal credentialing process of having this this certification pathway that we have built in with Hello Sono. And this is kind of the direct link to the exam review page. You can also just go to Hello Sono and look under services. You'll find it there. We do have also a trial offer. So you can get your first 3 exams reviewed for free. And if you sign up, it takes you to a form and explains to you exactly how to submit your first images. And we'll share that with you as well in the email. And then finally, I just wanted to end with this kind of everything in one place link to our site that has a lot of different resources around reimbursements. We have ROI calculators. We have some downloadables, including DVT clinical pathways, CPT codes, and also this will take you to our events page that has our future webinars listed on there. So I think with this, I am going to end and take some questions.